Verinata Health provides non-invasive prenatal tests for early identification of fetal chromosomal abnormalities. From a single maternal blood draw, the Verifiy prenatal test aims to reduce anxiety, as well as the risk of current invasive procedures. Verinata is committed to helping clinicians offer the latest in prenatal care for patients.
The Verifiy test is designed as a non-invasive prenatal diagnostic test for chromosomal disorders, and it's designed to test for those disorders by taking a small sample of maternal blood and then looking for fetal genetic material in that blood.
It tests for a number of different problems, including trisomy 21, which is Down syndrome, trisomy 18, which is Edwards syndrome, and trisomy 13, or Patau syndrome. It also tests for something called monosomy X, meaning there's a single X chromosome, which is also Turner syndrome.
Our study was designed to really mimic what would happen in the lab. You don't know what's coming in through the door. It can be any abnormality, any place in the genome, and you don't know what you're going to predict or how that's going to affect what you are going to see. And this is the only study to date that has done it that way.
One of the advantages of the Verifiy test is that because it is a simple blood test, it can be done in any physician's office. It doesn't require specialized draw sites. It doesn't require specialized people to draw the blood. The test is done in the doctor's office and then sent off-site, making it very accessible for any patient to have this done.
After describing the test and the limitations and the benefits of the test, one tube of blood is drawn from the patient.
We take a sample into our lab. We prepare plasma from that. We are able to purify out the cell-free DNA that's inherent in that sample. And then through a process called massively parallel sequencing, where we take that cell-free DNA, replicate it, put it onto a flow cell, and then sequence it in a sequencing device. We're able to define that, those small pieces of genome, and then actually map them back to a map of the whole human genome. And so we align these small pieces of cell-free DNA back to the parent chromosomes. And that allows us to then count the chromosomes and then express that as a ratio, a normalized chromosome value.
The current screening methods are more of a risk assessment as opposed to giving a patient a definitive answer, and that's often a very difficult concept for a patient to understand. So anything that can give them a more definitive answer is much easier for them to use in a helpful way for them to make decisions.
A lot of the other conventional screening out there can't be done until some people get it done in 11 weeks, some people 12, 13, 16, 18, 20, whatever it may be. So this being done as early as 10 weeks, you can get information by that 12-week mark.
The Verifiy prenatal test will change practice significantly in that it will markedly reduce the need for invasive testing. We'll be able to identify a very high-risk group of women, and only those women will need to go undergo testing.
I think patients are very hungry for information. I think patients are excited to know things early on so that they can plan. And I think that any testing that can be done that's non-invasive and that's early is a gift that we can give to our patients. So it's a win-win for the mother and the baby because the child and the family get better care with advanced knowledge of a problem.
At Verinata, they've worked really closely with going out there and educating the genetic counseling community. We bring in the personal experience of understanding what patients need, what counselors need, what the physicians need in the office, and we can help them to provide that to the community out there.
What differentiates Verinata, I think, is our sole focus on women's health. And that's true if you were to go to, the employees in accessioning, the people that run our clinical lab, our staff in the field. They all share that single-minded dedication to the patient.